Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. Alcoholism, or alcohol use disorder, is characterized by difficulty controlling the amount of alcohol you drink despite experiencing negative consequences. It's a complex condition with many causes, with genetic, physiological, psychological, and social factors all playing a role. Family history of problematic alcohol use increases the likelihood of developing alcohol use disorder, as does trauma. However, neither a family history nor experiencing trauma necessarily means you will have a challenge with alcohol. And importantly, the absence of trauma and family drinking problems doesn't necessarily protect you from developing alcohol use disorder. A person's upbringing, peer influence, and access to alcohol are all factors. Underlying mental health conditions, from anxiety and depression to psychosis, may also increase risk. Alcohol use disorder exists on a wide spectrum. Your use of alcohol might impact your work or relationships, or it may affect your ability to make good decisions, for instance, driving while intoxicated. You may develop an increased tolerance to alcohol. In other words, it takes more and more alcohol to get the same effect, and experience withdrawal symptoms like craving and tremors when not drinking. You may neglect important life obligations and continue to use alcohol despite its negative effects on your health and well-being. Once you start drinking, you might not be able to stop. Over time, excessive alcohol can lead to chronic diseases and other serious health problems like high blood pressure, heart disease, liver disease, cancer, and even dementia. There are a number of considerations when diagnosing alcohol use disorder. Your doctor might ask you some questions related to your drinking habits and how your drinking impacts your family and friends. A physical exam might indicate complications of alcohol use, and lab and imaging tests can reveal damage to your body caused by alcohol. You might complete a psychological evaluation to explore your symptoms, thoughts, feelings, and other behavior patterns. For some people, they know they have a problem with alcohol. For others, they may not recognize it, but their family and friends might be worried about how much they drink. Fortunately, there are effective treatment and management strategies available for alcohol use disorder. The choice of treatment may depend on the individual's unique circumstances and what actually is available as treatment. Options include detoxification. This means safely managing withdrawal symptoms over a period of days in a medical setting. Behavioral therapies and psychosocial treatment interventions like cognitive behavioral therapy or CBT, motivational interviewing, and family-based therapy to address the psychological aspects of alcohol use disorder and to engage with treatment. Pharmacotherapy, medications prescribed by a doctor such as naltrexone or acamprosate may help reduce cravings. Mutual support groups, both in-person and virtual, can provide peer support. Lastly, inpatient or outpatient rehabilitation treatment might be required for more structured and intensive treatment. Treatment for youth with alcohol use disorder often initially consists of psychosocial interventions alone, as most alcohol use disorder medications have not been studied for safety and efficacy in this age group. However, naltrexone and acamprosate may be offered to youth for treatment of moderate to severe alcohol use disorder on a case-by-case basis. It's important to note that the path to recovery varies from person to person, and ongoing support is often essential. However, there are lots of reasons to be hopeful, as people do recover from alcohol use disorder. Preventing alcohol use disorder begins with awareness. Individuals, families, and communities can take steps to reduce the risk of developing this disorder. Strategies may include encouraging responsible alcohol use and educating people on its risks, avoiding secrets and stigma about a family history of alcohol use disorder so that young people can be aware of their own personal risk, promoting healthy coping mechanisms for dealing with stress and strong emotions, providing support and understanding for those struggling with alcohol use, and limiting access to alcohol, especially for individuals at higher risk. In addition, implementing routine screenings in primary care of alcohol use is an important public health strategy to identify high-risk alcohol use and prevent alcohol use disorder. We know that the easier to access alcohol is, the more risks for harm go up at a population level. So regulating the price and availability of alcohol is also important. In summary, alcohol use disorder is a multifaceted condition with diverse causes, recognizable symptoms, established diagnostic criteria, and effective treatment options. Prevention efforts can also help reduce the risk for those who may be vulnerable. Thank you for joining us in this exploration of alcohol use disorder, and stay tuned for more evidence-based insights on critical health topics. I'm Dr. David Goldblum. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.